Your smile is one of the first things people notice about you. But if you're self-conscious about your teeth or your mouth, you may not be smiling much at all.
The doctors at Carolina Center for Oral and Facial Surgery can help with something called dental implants. Welcome Dr. Peter Franco and Dr. Gregory Tull to our show. Hello, people. How are you doing today?
Thanks for having us.
Thank
you.
Yeah, it's good to see you guys. First off, what are dental implants?
Well, a dental implant is a titanium screw that's inserted into the jawbone, upon which a crown or a cap that is fabricated to sit on it. What you're seeing on the video here is just a dental implant that's being used to restore a front tooth.
So why would somebody need a dental implant?
Well, that's a great question, Colleen. Typically, a dental implant is designed to replace a missing tooth, whether that's functional or aesthetic. The nice thing about dental implants as well is they don't come in and out of your mouth. They're a fixed appliance.
So they act like, they feel like regular teeth, right?
They act just
That's
like
right.
a regular tooth.
You can floss between them and
Okay.
So what is involved in an implant? What is involved in the whole process of implant placement?
Typically with the dental implant placement, it starts with a consultation with one of our board-certified oral and maxillofacial surgeons at the Carolina Center for Oral and Facial Surgery, and that involves a clinical and a radiographical exam. And then based on the patient's circumstances, we determine if they're candidates for implants. And we use the latest technology, especially a cone beam 3D scanner, to specifically design and place these dental implants.
Let me ask you this. What can happen if you don't replace a missing tooth? Because I think a lot of people are thinking it's just aesthetic and, you know, why they may not like it. They don't think that it's, you know, that big of a deal. What can happen if you don't replace a missing tooth?
Sure. You can have, you know, moving teeth, shifting teeth, or a change in your bite. And it's that change of the bite that can cause, you know, micro trauma, damage to the teeth themselves, or macro trauma, essentially damage to the muscles and the joints, specifically the TMJ. I'm sure you guys, everyone's heard of temporomandibular joint problems. You know, missing teeth can lead to that for sure.
Okay, anesthesia. All right, what choices do I have in anesthesia? Because I want to know if you're going to be putting a screw in my mouth,
That's right.
put me to sleep twice.
All of our facilities in the Charlotte area are nationally accredited for delivery of all types of anesthesia. So that ranges from being awake with locally numbing the area to being completely asleep with general anesthesia, safe and comfortably.
How long does the procedure take from start to finish?
Great question, and that depends. It could be as short as leaving our office the same day that we put the dental implant in, leaving the same day with a tooth or teeth, or up to traditionally 6 to 8 months before we can put a crown on that dental implant.
Wow. And then will that implant last the rest of your life, or at least for several years?
It's another awesome question. The success rate for implants, the 20-year success rate is up in the 98th percentile.
Great.
So it's extremely high. At our practice, we typically place about 1,000 implants per year. The picture you're seeing on the screen is, again, that 3D scan that Dr. Tull was talking about of a dental implant that's been placed and is ready to have a crown put on by the patient's general dentist.
Let me ask you this. How does this change people's lives? Because I have seen people who might be self-conscious about their teeth. And we mentioned you may not smile a lot if that's the case, or they keep their hand over their mouth, that kind of thing. How can dental implants literally change people's lives?
Yeah, they really can. I mean, you'll notice if people are missing teeth, especially from a functional standpoint or molar teeth, they obviously have difficulties chewing. But when it's a front tooth, people know it's not there. They're going to change their smile, their appearance. And, you know, all the studies show one of the biggest and most important things for us is our smile.
Can totally change your self-confidence, too.
Absolutely. Yeah, you can have patients who get a full set of dental implants. They come in 2 months later, they got a new job. You know, got a new car. It's a whole new life.
Get a divorce.
Yeah.
Well, all that must be very rewarding, though, to be able to help people feel better about themselves.
Really
Absolutely.
And you mentioned they function like regular teeth. Like, can you take a bite of an apple? Could you eat a steak, corn on the cob, that sort of thing?
Yeah, you can. Good. Greg?
Yeah, they act like your normal teeth. Once they settle and fuse with the bone, the dental implant is designed to be there for the rest of your life, just like the root of the tooth would be. You can chew, eat, speak, do whatever you want, just like they were your natural teeth.
Isn't that amazing? If you've ever considered replacing missing teeth or you're interested in dental implants, take advantage of the complimentary consultation being offered by Carolina's Center for Oral and Facial Surgery between now and the end of May. Visit mycenters.com, or call them at 704-347-3900. I'll say it again, 704-347-3900. Thank you so much for being here today.
Thank you for having us
so much.
Appreciate it. All right, lots more ahead on Charlotte today this morning, including a solution to a little problem parents know all too well: what to do with all that artwork your kids bring home.
Our next guest has some fun, unique ideas to display it in your home.